Okay, I think we're going to get started here this morning. Thank you, everybody, for joining us. I think we still have a few people coming in. So as always, we say it's great to see you. And we certainly look forward to the day and the time where we really can physically see you in front of us. So, but thanks for being with us here today. My name is Jean Alton, and I'm a clinical care coach with Alzheimer's San Diego. And we are going to be talking today about maintaining your brain health. And I'm very happy to have with me co-presenting my colleague, Mina Nilchian, and she is a senior clinical care coach. Mina, jump in.
Hello, good morning. This is one of my favorite classes, so I'm excited to be here and see the attendance numbers go up.
It is, and Mina has lots of good information to relay to us, but also some really good nuggets. I call them nuggets because they stay with me, and I think they'll stay with you as well too. She's just got some great insights and words of wisdom to share with all of us.
Thank you, Jean. You are too kind.
Well, it's the truth. I'm also very happy to introduce our other colleague, Jessica Cortez, who is with us here today. She is also a clinical care coach. Say hi, Jessica.
Hello, good morning, everyone. Happy to be here today.
Jessica's going to be managing both the Q&A and the chat for us here today with regards to questions that any of you have as we go along. And she'll be joining us during some of our question and answer sessions within the webinar. So we'll give you a little bit of instruction on how to get that information to Jessica. We also are very happy to have with us another person who's very important, and I'm going to introduce Tan.
Hi, I'm Tyan, and I'm the tech team volunteer. So if you have tech-related issue, feel free to shoot me a private message in the group chat. I'll respond as soon as possible.
Thank you, Tyan.
Thank you, Tyan.
So this is our agenda. So we're going to be reviewing the key factors in healthy aging. And we're going to put that over to Mina to start with. And after she's done her section, we'll talk about the common symptoms of dementia and how they are different from normal age-related changes in our memory and cognition. And then we'll talk about lifestyle factors. So Mina, I'm going to turn it over to you. And I am also going to, just in a moment here, give you the remote control.
Beautiful. I think I have it. Usually takes me a second to be able to advance that slide, but I will get there. It always takes a minute, doesn't it?
Yep. It's advanced.
There we go.
Yep.
Got it. Okay, beautiful. So yeah, we want to take some time to differentiate between a typical aging process and what is going to be the topic of what Jean is going to talk about, what dementia really is, because it's a really important distinction. Change is inevitable, right? And we see changes in all systems of our body as we age. And one of the themes that you're going to notice in today's presentation is the way the interconnectedness of all of these systems within our bodies. The title of our presentation today is Maintaining Your Brain Health, of course. But we have found through research that really it's hard to talk about just the health of your brain without incorporating all of these other systems within your body. And so you're going to notice that. You're going to notice the cascading effects that different systems in the body have upon each other. So when we see normal changes in the aging body, it's very normal to lose some muscular density as we age. Same with skeletal density, things like osteoporosis, even arthritis, these effects that the age has on our bones. That's a big part of the aging process. we also see some changes in our cardiovascular system as well. The way that the heart is able to get blood into all of these different systems in our body. And these changes actually have a profound effect on us and on our brain. And what we're going to talk a little bit about is that heart and brain connection that research is finding to be more and more salient. But what's typically tending to happen as we age is this shrinking of blood vessels and it becoming just a little bit harder than it used to be for blood to get where it needs to get. And there are definitely things that we can do to impact that, to address that. But I think the heart is a really big theme in brain health. And so try to keep that in mind as we talk a little bit more about this today. Our digestive system begins to change as we age. Those foods that we used to eat when we were younger might be a little bit harder for the digestive system to process as we get older. The digestive tract's ability to absorb the nutrients that it used to absorb, to comfortably digest those tougher to digest foods, that becomes more, that might become a little bit more challenging as we age. And what we eat has a really big impact on our quality of life, whether it's what we eat making us comfortable and not causing us discomfort and pain, and getting the right nutrients to those other systems in the body. Sensory abilities also are impacted as we age. So the ability to see and hear are big ones. Things like hearing aids and glasses become more important than ever before. And those particular things can really have an impact on daily quality of life, being able to interact with the world as we always have. And then skin also changes as we age. We tend to lose a little bit of that elasticity, that collagen production goes down a little bit. So very normal to notice that as well. All right. So when it comes to the aging brain, right, we're kind of drilling down into that brain a little bit since this presentation is on brain health. We have physical changes in the brain that are translating to our cognitive function, right? The way that we think, we process information, that's all cognition. But let's talk a little bit about what's happening physically in the brain as we get older. First thing that we notice is a very gradual loss of volume, loss of size. The brain is ever so slightly shrinking during the aging process. I say ever so slightly because dramatic loss of volume in the brain is indicative of something else. But within the normal aging process, there's a little bit of shrinking that's happening in the volume of the brain. There's less of that communication between the neurons, right? The foundation of thought, the foundation of how our brain works has to do with these electrical pulses happening between the neurons in the brain. And as we age, those pulses are quieting down, just mellowing out a little bit. And so it's not as rapid fire as it was in younger years. And reduced blood flow, right? Remember what I talked about in the last slide, these changes to the cardiovascular system? We're seeing that translate within brain health as well. With age, with this kind of little bit of constriction of the blood vessels, the blood flow in the brain is not as heavy as it used to be. And the ability to get blood to where we need to get is the foundation of our health. And so it's going to have an impact. So what does that mean for our ability to think and process information? Mild memory decline is a normal part of aging. And mild is the key word here. You know, having to kind of retrace your steps a little bit more often, having to think a little bit more to retrieve that piece of information that you just learned, forgetting things every now and then. That's a part of the aging process, right? That communication between the neurons not being as quick as it used to be, the learning process, being able to create new memories isn't as strong as it used to be. So a little bit of that mild memory decline is very much a part of that aging process. Now, there's a distinction between that and what we know to be dementia or a dementia-related pathology. And Jean is going to go over that a little bit in her section. So making that distinction between what the mild memory decline is versus what is something else that's going on. That won't necessarily be the really big topic of our presentation today. And we do have a class called Dementia 101 that goes over that just a little bit more to understand that a little bit better. Control and maintenance of attention is a really big one that changes as we age. This ability to control your attention, to be able to retain that focus on that one particular thing, or what is commonly referred to as multitasking, right? So what are some forms of multitasking that we typically tend to do? Now, I could be writing something down while Jean is telling me about her day, or a little bit more of a dangerous example is going on our phone while we're also driving, just responding okay in the text message. Actually, we call that multitasking. There is no such thing as multitasking. The brain really is able to do one focused task at a time. When we're doing those two things at once, or we think we're doing those two things at once, the brain is doing this amazing thing where it's actually rapid fire moving between those two tasks. So if Jean is talking to me while I'm taking notes on something else, what's actually happening in my brain is this rapid, undetectable switching between the two tasks. As we age, that rapid fire switching between the two tasks is getting harder and harder. So we think we used to be able to multitask, which we weren't, but now we're really noticing it's harder and harder to do that. And in the case of, texting and driving, it was probably a good idea never to do that in the first place, right? So that's a part of the aging process. And then sometimes it just starts to take a little bit longer to process information, right? Somebody comes flying through the door and telling you the story about something crazy that happened in their day. It might become necessary for you to tell someone, wait a second, slow down. I'm not able to absorb what you're telling me right now. Just processing that information, having to have someone repeat something to you a few times before you absorb it. If you have taken education classes later in life, right? You went to college and then decided 10 years from now you're going to take more college classes. You probably noticed that. You probably noticed that you need to read those notes a few more times than you used to back in, the years of your 20s. So that is also a part of the aging process. And all of these things, there are ways to adapt to them, right? It doesn't mean that life becomes less accessible to us. There are just things that we do to adapt to these changes and stay connected with the world, because that's going to be another thing that we talk about in this presentation is just because we're aging or just because we're dealing with, a dementia-related diagnosis doesn't mean that there aren't still things that we can do to stay healthy and stay connected with the world. And so there are certain factors that affect the process of aging. And there are factors that are within our control, and there are factors that are not within our control. We're going to spend a lot of time talking about the things that are in our control because they are in our control. One of the big things is genetics, right? How we age has a lot to do with how our ancestors aged. Things like life expectancy or predisposition to certain chronic disorders, even to a degree, we're good, right? Okay. Even to a degree, our risk of developing dementia is can have a genetic factor to it. There are also disease risk factors. A lot of those chronic metabolic disorders, diabetes, heart disease, high blood pressure, obesity, they're going to have an impact on how we age, and they're going to affect that brain system because they affect the body, they affect the physical body, they might affect how the heart is pumping blood. All of these different things are connected, and so disease can play a role in how we age. And not just those particular diseases, but any sort of pathology is going to have an effect on the aging process as well. Our environment is a really big one. Culture is one that I think is really interesting to talk about because there's so much to be done in our cultures about aging, right? It's going to make such a big difference in our lives if we live in a culture that encourages vitality in older age. If we live in a culture that encourages us to stay connected in every stage of life, I think that's going to have a much positive impact on the aging process. And so I think that's something that we try to do at Alzheimer's San Diego, is see how we can affect the culture around aging so that we can encourage each other to stay active and stay healthy in our older age. Occupation and stress levels, occupation can have an impact on our aging in a number of ways, right? Is our job stressing us out? Is our job affecting our sleep? Is our occupation making us frustrated? But then there can also be a different side to occupation and how it affects aging. Is our occupation a source of social interaction? Is our occupation keeping us cognitively challenged? So it's just a good thing to think about, is what impact is my job playing on my quality of life? And then another thing is education, right? The research shows that higher numbers of years of formal education is associated with reduced risk of cognitive decline. So we have this inverse relationship. And there's definitely some positive impacts of education. And even if, we can't go back and change how many years of formal education we got when we were younger, it speaks to this brain's need to stay active and stay challenged, to be used. And so then there are lifestyle and controllable factors, right? Can't necessarily go back in time and change our genes. We can't necessarily stop working, right? Occupation is not something that we can just decide that we're going to opt out of anymore necessarily. And culture is something that we change in the long term. So what are we going to focus on today? We're going to focus on, later in this presentation, those things that we do have quite a bit of control over to maximize our brain health in every stage of life. So we're going to spend a lot of time on that particular topic. So when it comes to what those factors are, for overall health, managing your numbers. Now, I don't believe in reducing people to numbers, right? I don't believe in reducing people to a piece of paper that just says your weight and your blood sugar and your cholesterol and all of this. I think health is a very holistic, rounded thing. But there is something to be said about being able to look at this profile of where your blood sugar is, where your blood pressure is, where your cholesterol is, where your BMI is, and how that might be contributing to brain health. We typically see that if you're able to get one or all of these numbers under control, you're going to see an impact on your cognition as well. And the really beautiful thing is that you can actually really just focus on one of these, and the chances are that the habits that you're incorporating are making an impact on all of these numbers. Like I'm going to keep saying, the brain and the body are an interconnected system. And so when we have those systems being taken care of, it's going to make a difference in how your brain is able to compensate for either a dementia pathology or just the aging process. Smoking is a big one. I think, the world of health and science talks a lot about smoking and the impact that it has on your body. If you are a smoker and you quit smoking today, as hard as it'll be, you're going to notice an impact on your overall health and your cognition and the aging process. And the interesting thing about smoking is that we think it's just a matter of what it's doing to your lungs. But there's a lot to be said about what it might be doing in terms of vascular constriction. Even your skin can be affected by smoking. And I think I haven't delved into the research on smoking and cognition, but I think because it does affect those other systems of the body, that there can be a domino effect of how smoking can affect cognition as we age. Mental health management is one that I don't think gets talked about enough. And depression is very profoundly present in the older adult population. And it has to do with a lot of things. And I think a big thing that it has to do with is the phenomenon of isolation as we get older. And I'm, presenting to you in an era when we're all isolated, and we're noticing the impact that it has on our mental health. And I want to take the time to talk about, later in this presentation, not letting perfect be the enemy of the good. The things that we used to do to manage our mental health and to really lift our hearts and lift our spirits might not be accessible to us anymore. But I want to encourage that we always look for the next best thing to stay connected. Because for most of us, I would say a majority of us, we're social creatures. Humans were meant to be social creatures. And our bodies and our brains feel it when we're not able to do that. It's also worth noting that the symptoms of depression can very often mimic the symptoms of dementia. So a lot of times people think that they're dealing with a memory loss issue, but it might actually be untreated depression. And sensory loss is small but big. We talk a lot about how sometimes we don't realize the battery on our hearing aid is running low, or that our glasses prescription is out of date. And so it starts to get a little bit harder to interact with the world, but something as simple as changing that battery in your hearing aid, or cleaning your glasses, or updating your glasses can make an impact on how you're able to interact with the world and stay socially engaged, which we're going to talk about being an important factor in quality of life. So just take a second to remember, when's the last time that I changed the battery on my hearing aid? Am I supposed to be wearing a hearing aid and I don't? So that's a really small but big change, like I said. And then we're going to talk about all of these bullets later in the presentation. So don't worry, I'm not just going to whiz by this, but the 5 bullets that you see are really the formula to quality of life, and quality of life translates to brain health. Exercise, diet, intellectual stimulation, social activity, and sleep. And I do want to take the time in this part of the presentation to say that when we talk about topics like this, we're talking about evidence-based and research-backed, right? It's our job as an organization to look at what the research is saying, what the cumulative kind of conclusion of the research is, and bring you things that are backed by science. We don't just read one, clickbaity headline and then decide that we're going to talk about that and get really excited about that. We want to see large-scale studies and what these large-scale studies promote, because there is harm in throwing everything at you and telling you to do all these things. It could lead to you wasting your money, or you not pursuing the thing that actually works for quality of life. So in this presentation and in all presentations at Alzheimer's San Diego, we really prioritize research-backed and evidence-based materials. So you can rest assured about that we've done our homework, and we always do our homework. So Jean, I believe I'm going to pass it on to you.
You are, and I thank you. And Mina, I just have to cop to it. The 2 little slide advances, that was me.
That's okay.
I'm moving my mouse around on my screen, and apparently it thinks I'm taking control again.
It keeps me on my toes. I appreciate that.
Yeah. So anyways, now what I'm going to do is talk with all of you good people about the common symptoms of dementia and how they are different from normal age-related changes. And I know this is an important area because there's lots of us, I include myself in this group, lots of us that worry a little bit about, what we're doing. It's like, oh my God, I forgot about this. Do I have, am I developing dementia or Alzheimer's disease? What's going on? So we're going to just kind of break it down a little bit here. So first of all, just to give everyone kind of some of the basics here, is for all of you to understand the difference between dementia and Alzheimer's disease. And dementia is the word that we use to describe a syndrome wherein symptoms are being caused by some other medical thing that's going on. And whatever that medical thing that is going on is affecting cognition, it's affecting cognitive function, and it is interfering with normal daily activities, okay? So it's just, this is a very general kind of description and definition. So Alzheimer's disease is a type of dementia, and in fact is the most common type. And with Alzheimer's disease, it is a progressive and degenerative disease of the brain that is affecting cognitive function, it's affecting memory, it's affecting the physical realm in terms of sensory perception and such. And all of these things that Mina has kind of been speaking to. And so it's the takeaway here that is important for all of you folks to understand is that dementia is describing these general symptoms that actually a variety of diseases and disorders have as symptoms, and Alzheimer's disease is the most common type. So in a quick nutshell, Alzheimer's disease, not everybody with dementia has Alzheimer's disease, but everybody with Alzheimer's disease does have dementia, okay? So think about that a little, and if you have questions further on it, you for sure reach out here to Jessica. As Mina referenced, we do have a class that's called Dementia 101, where we do delve in a little bit deeper into some of the other types of dementia, and we just explain it a little bit further than we do for today's particular webinar. So here's where we get to the nuts and bolts of this section. And what I want to do, we're going to go through these things, but I want to give you a real life example. And this is my life, as I often give my own examples. And this is honest to God, the truth. It's not made up. And this happened just about 10 days ago. And it's kind of funny, but you know, it kind of speaks also to those times where we're like, oh my God, what is going on in my brain? So understanding the context of, you know, obviously our lives today, as Mina has talked about, we're in a pandemic, we're sheltering in place, there's a whole bunch of things about our daily life has changed. And I'll say quite frankly, for me, the pandemic and sheltering in place has slowed my cognition and affected my memory, because I think the lack of kind of social engagement and stimulation and the cognitive stimulation from that as well too. So a couple of weeks ago, we ran out of dishwasher detergent. So, you know, we've been ordering stuff off of Amazon, as many people are doing. So I ordered some and it came. And I honestly don't remember which of us put the container of the dishwasher detergent under the sink. I'm kind of think it was my husband, and so I went in to get some out. Dishwasher was loaded and get it going. And I did notice that it was the powder instead of the pods. But, you know, we know there's powder dishwasher detergent that's used. So loaded it up, started the dishwasher. When it was done, the dishes weren't quite as clean as I wanted, and the glasses were really cloudy. So I ran it a second time, same thing. And at some point during this procedure, my husband said to me, he said, "Why did you get the powder detergent and not the pods?" And I said, "Well, I thought I ordered the pods, but I don't know. Who knows, you know?" And so after the second round with the dishwasher and the dishes still weren't good, I pulled out the little box of the powder detergent. I was using laundry detergent in my dishwasher. Yes. OxyClean is great for making your towels smell pretty. My dishes smelled pretty, but they were not very clean. So why do I give you this example? Well, I think it's kind of a good example of, you know, how circumstances right now have changed, forcefully put change upon us to how we operate and normally do things. And so let's just look through this little list here and see how maybe we apply this. Normal age-related changes may be difficulty remembering names or finding words. That's when, you know, we're in conversation with someone and we say, "Oh, you know, what was her name?" We can give all sorts of details about her, where she worked or where we met her or what her family situation was, but we can't remember her name. It's very common, and it's normal. It's not something to be particularly worried about. We misplace objects more often, most certainly that's me. And my examples, as always, are both my phone and my glasses. I'm always constantly hunting for them. Our thinking, as Mina referenced as well too, has slowed down. Our brains take longer to learn new things, and we do have changes in attention or concentration. So our ability to focus and pay attention and concentrate is lessened as we age. And I think this is one of the areas that is a good example of how we ended up using laundry detergent as dishwasher detergent. There were several lapses in attention and concentration there, right from when the stuff arrived at the front door and made its way, you know, into the kitchen rather than out to the garage with the washer and dryer. And even when we both noticed the stuff was powder and it wasn't the pods, we still didn't, you know, pursue things further than that. So our attention was not grabbed in that moment. The physical changes that occur that are normal are the sensory ones: vision, hearing, and other sensory loss. And in this example I gave you of what happened to us is I do have the habit, whether good or bad, of often not having my glasses on here when I'm in the house. And so that also contributed to this mix-up, because I couldn't see what the writing was on the little box underneath the sink until I actually took it out and put my glasses on and saw it was laundry detergent. We do have reduced strength and flexibility as we get older, as Mina talked about also. And, you know, so that's to be expected, that there are changes going on. Now, for sure, behavior changes are not considered a normal part of aging. And I just will say, with the exception of what we have going on right now, which again is circumstances beyond our control, that has changed our behavior in ways, and sometimes positive ways, and sometimes not so positive ways. You know, we might be acquiring new hobbies and new skills, which is fantastic, but we're less socially engaged and connected, which is not so great. So these are all the parts and pieces of normal aging. So if you're worried about yourself, you know, the thing is, you can always give us a call at Alzheimer's San Diego, and we can just talk with you through whatever you're experiencing to give you some ideas as to whether, you know, you're onto something. There maybe is something going on, or is it just normal age related? And remember about me using laundry detergent in the dishwasher. So how then would symptoms of dementia present in a different manner in these 4 areas? Well, a person with dementia might be getting lost in familiar places. And by familiar places, that could be everything from their home to their neighborhood to their community. I've lived in my neighborhood for 20 years, so I know it pretty well. If I get lost in my neighborhood, that would be something to pay attention to. My Vaughan store is just about 10 blocks away from me. If I were to get lost either on the way to or back home from Vaughan's, that would be a concern. Forgetting the function of objects, what they do. Okay, so I didn't forget what the function of the powder was with regards to laundry detergent versus dishwasher detergent, but rather it was kind of misplaced and overlooked with poor attention. If I was somebody with dementia, I might continue using laundry detergent in the dishwasher, or even the other way around, because I'm forgetting what the function of this particular item, this object is. With regards to thinking, cognition, if I am a person who's developing dementia or has dementia, there's difficulty with planning and sequencing. And so thinking just about those tasks in our lives that are a little bit more complex, planning a meal, budgeting, looking at bills, making sure bills are paid and when they need to be paid in order to avoid late fees and that sort of thing. that's planning and sequencing, and that becomes a challenge for people with dementia. People with dementia are unable to learn new things, which is different from being slower to learn new things. Why are they unable to learn new things? Because of the damage that's going on in the brain in the hippocampus area. People with dementia aren't able to learn new things because they can't capture the knowledge, the information, and this, the information about the skills they need in order to do this new thing. They can't keep that in their memory, so therefore it doesn't happen. People with dementia can have some really significant changes in their visual spatial perception, and the visual field can become much narrower. And if we just think about that for a minute, if I'm, all this information that's in the wider scope of my vision gets so much smaller, how is that going to affect me physically? Well, maybe it means I trip more easily, I fall more easily. I might not see the edge of the table as I'm having my sip of coffee. And so I put it down, and in fact, it's not going on the table, but it's falling and spilling all over the place. So yes, problems with balance and falls and the like. Changes in behavior can and do occur in folks with dementia, and sometimes they can be positive, and sometimes they're not. For the families that have somebody they're caring for living with dementia who has the positive change, those aren't the families we usually hear from. It's usually when there's challenging behavior changes. So it could be mood or personality. It could be people getting angry, combative. Absolutely, people with dementia have difficulty initiating new tasks. The initiating part of things is not working, what I always refer to as the start button. And there is social withdrawal. So, and again, just in view of what's happening in our world today, is some of these things are affecting us as a part of normal change related to the pandemic. So we have to kind of be careful to keep that in mind as we are operating here today. So what are some of the risk factors? Well, the number one risk factor is age. The older we are, the older we live to, the more likely we are to develop some type of dementia. So, at age 65, I think it's about 1 in 9 people develop dementia, and by age 85, it's a number that's between 1 in 3 and 1 in 2. So the longer we live, the more likely we are to develop dementia. Women have a higher risk of developing dementia than men. Research is uncertain as to the whys of this. And they are looking at, the hormonal differences between men and women, and particularly as it relates to women who have been pregnant at some point in their lives and how those hormones are changing and are different. Genetics can be a risk factor for some families, although a very, very small percentage, where in fact it is a genetic marker that is passed on and shared amongst family members that is increasing the risk factor for developing dementia. Family history is another risk factor, just by virtue of having a first-degree family member, such as a mom or a dad or a brother or a sister with dementia. That ups your risk factor. The health conditions that Mina referenced, and she will be talking about a little bit more just in terms of managing these health conditions, is hypertension, high blood pressure, heart disease, type 2 diabetes, and untreated hearing loss. These are all risk factors for developing dementia. As she mentioned as well, years of formal education with the inverse relationship. Having more formal education decreases your risk factor. Having less education increases. And she will likely speak to this, but we're not even necessarily talking about, you know, oh, I went to college for 10 years kind of thing. But, you know, intentional learning where we are in, like today's setting, basically a classroom setting where we are here to acquire knowledge. That's protective steps that we can take to hopefully reduce our risk of developing dementia. Head trauma is a risk factor. Everything from if you had a bike accident when you were a kid and knocked your melon and were unconscious for a period of time, that would be a risk factor, even if it happened when you were 10 years old. And, you know, for sure we see many of our professional sports people right now with football, hockey, soccer, or some of those other hard-hitting sports where there is head trauma going on, are at higher risk for developing dementia. And additionally to that, some of our people who are serving in the military that have been exposed to, you know, explosive devices and any types of situations, combat situations that result in concussive damage to the head, they are also at higher risk factor. Down syndrome is a risk factor because folks with Down syndrome who carry the extra chromosome also are carrying the marker that increases your risk factor for developing dementia. So there is no definitive evidence yet about what can prevent Alzheimer's disease or age-related cognitive decline. And yes, the source, the National Institute on Aging. And this is an important statement. And Mina and I will answer some questions, but Mina will kind of get into the meat of that shortly. The important words here, there is no definitive evidence as to what can prevent Alzheimer's. So, and that is supported right up to this date in time. So what does that mean? It means it's important for all of you to be savvy consumers, to be questioning consumers, to be critical thinkers when you're looking at what is out there and how it's being marketed towards you. If you're seeing something or hearing from someone that is saying, this is going to prevent Alzheimer's disease, you should have some warning bells going on right away. And we're going to delve into that a little bit. But first, let's pause for a moment. We're going to bring in Jessica. And let's see, do we have some questions from the first half of our session here today, Jessica?
Yes, we do. So we actually have two questions that are very similar, and they're asking about hearing loss. How do we know that that is a risk factor, or do we have any more information on that research?
Mina?
Yeah, I did notice quite at least a couple of questions about why it's a risk factor, and it's a good time to clarify what a risk factor is. It's not necessarily a causal relationship. A risk factor is something that we see associated with something that frequently. And so we notice a lot that untreated hearing loss is connected to a higher risk of developing dementia. To be honest, I don't know what that relationship exactly is, and I think researchers don't either. And a lot of these risk factors, if you were to ask a researcher, well, why is diabetes associated with a higher risk of dementia? They might not be able to tell you the exact mechanism why. There might still be a really big old question mark there. And the truth is, I think, you know, if I were to throw out a guess of one thing that could be a contributing reason why that's a risk factor is when you can't hear the world, you can't interact with the world. And when you, or I'm sorry, that was poorly worded. Hearing, not being able to hear and not treating a sort of hearing deficit can really impact the way that you interact with the world. Some people rely on sign language to interact with the world. That's still interacting with the world. But when there is a treatable hearing loss that isn't being addressed either through adaptability, like developing sign language as a communication mechanism, or hearing aids, it's going to impact the way that you connect with the world. Now, what could that mean? Maybe that means that you're not communicating with the people around you. Maybe you're not as active as you would like to be. And maybe that's contributing to the other ways in which you're taking care of your health. So when there's a big why question mark about a causal relationship, to me, I think there's something to be said about what that might be doing for your overall health. So it's an answer and also not an answer. The real answer is I don't quite know, but then the other answer is maybe it's affecting overall health as well.
Yeah, right. And I would agree with that. It's kind of, I think some of the phrase that we have heard used with regards to hearing loss being a risk factor is, again, as Mina says, if it's untreated, you can be all alone in a crowd of people, in a group of people, because you're missing out on so much because of the hearing loss. And, that is akin to social isolation and disconnection and lack of cognitive stimulation and all of those things. So, but it is absolutely, research has been done in this area, and it is, the evidence is there. So it's an important area. And certainly if you call us at Alzheimer's San Diego, we can get you connected to more information in that area as well too. Mm-hmm. Jessica, is there other questions?
Yes, we have more of them coming in. So let's see. Is there a definitive diagnosis that there is dementia and it is Alzheimer's, and there are different treatments for the types of dementia? So it sounds, let's see.
So when it comes to diagnosing, it's a lot of diagnosing dementia, and what type of dementia it is a very sophisticated form of guessing. The only way we know 100% that what's going on in the brain is Alzheimer's, or it is frontotemporal, or it is Lewy body, is through an autopsy, right? Is through getting brain samples. So it's not a 100% exact science. And the question of what kind of dementia do I have is a question of what are the proteins and where are they growing. With Alzheimer's, it's tau and amyloid, and where they're growing is all these different parts of the brain. What neurologists and doctors rely on is certain different types of testing, testing in the office to see what areas of your cognition are affected, determining the symptoms, because they all have very distinct and symptoms that are distinct to their diagnosis. And sometimes they might use some imaging, like MRIs can also be really helpful. PET scans can also be really helpful. PET scans are typically not covered by insurance to diagnose dementia. So it is a guessing game to an extent, but it is a very sophisticated one. It's not just throwing things at a wall. They typically do a pretty good job of being able to narrow it down. The second part of that question of, I think it was the treatments for those specific types of dementia, there aren't treatments that stop the disease, reverse the disease. Unfortunately, the science is not there yet. For the case of, I think, Alzheimer's, there are some medications that kind of stave off symptoms for a while. Like they might help you, it's hard to explain the impact of the medications, Jean. We always have a hard time with the wording. They don't stop the disease, but they hold off the symptoms for a little while, and then the disease is eventually going to progress. And researchers are working really hard at finding some more that can be added to a regimen of medication to stop and prevent the disease.
Yeah. I think maybe we better move along here, Mina, because just in the interests of time, and we still have some important information to cover. So Jessica, we'll have you hang on to some of those questions for us and answer what you can. And, folks, unfortunately, we're not able to answer every question throughout the course of the webinar, but we will do our best. And we do encourage you to call us at Alzheimer's San Diego as well, too. Mina, I'm going to turn it over to you because I think you're going to talk to us now about these lifestyle factors that can decrease our risk.
Yes. So when it comes to the first point, physical activity, there is just, the research is growing on how physical activity has so many benefits for not just the body, right? We know being physically active is good for our bodies, it's good for our hearts, but what it does for our minds and our brains is this fascinating area of research. So what it physically is doing to the brain is these 3 points on the slides right here. It increases the volume of blood vessels, strengthens the connection between neurons. Now that fits beautifully with what we were saying before. The aging process can decrease the, there's some issues with, blood not getting to the brain the way that it used to. And exercise is a great way to bolster that and to keep that from happening as much. It also strengthens the connection between those neurons. Like we said, the connectivity between neurons is affected by age and sometimes by dementia, and exercise is a great way to bolster against that. Raises the level of nerve growth factor in the brain. That's a documented benefit of exercise. And it stimulates the brain's ability to maintain old neural connections and create new ones. And this can be a way to keep the brain healthy throughout the aging process, but can also be a way to help compensate the parts of the brain that are still healthy if you do have something like a dementia going on. And so exercise can mean a lot of different things for a lot of different people. And again, there's the theme of not letting perfect be the enemy of the good. So if exercise to you means a 5-mile jog, beautiful. Try to keep that up for as much as you can, as much as it's healthy, as much as it's possible. But if there comes a time when exercise really just means a 30-minute walk a day, or goes down to all you can manage is a 10-minute walk a day, don't give up that 10-minute walk a day because it's not a 3-mile run. Or if there are some mobility issues that start to set in, even if somebody is not able to get out of a wheelchair, there are still some exercises. There's chair yoga. Not letting perfect be the enemy of the good is really important to find adaptable ways to incorporate some kind of physical movement in your day. There's a lot of documented benefits to that. So this is a big one, and I'm going to spend a little bit of time talking about this because this is where the science and the marketing sometimes are at odds with each other. So we see a lot of headlines that this is the perfect food that you have to eat. This is the herb that you have to eat. This is the supplement that you have to eat. And we always want to be careful that marketing is marketing, right? Marketing, the purpose of a product is to be sold. And so we always want to make sure before we spend money on a supplement or start a very restrictive diet of a very specific type of food, that we check the research to make sure that that's actually holding up. So what we see holding up in the research first is this particular diet that's being described in these bullets. So the first one, lots of vegetables, lots of legumes, so that's beans and like lentils, fruits, whole grains, fish, and olive oils. And olive oil really in the category of good fats, right? Olive oil is a really good fat. Avocado oil is a really good fat. You notice that this diet is rich in things like micronutrients, fruits and vegetables. I think that there are very few people who would disagree that any diet could use some more fruits and vegetables. But this is what's referred to as the Mediterranean diet. You may have heard it before. It's very good for the heart. And researchers are noticing that this particular diet has a protective effect on the brain. So it's associated with a lower risk of developing dementia. Again, risk is not necessarily causality. It's not necessarily a one-in-one relationship that if you eat a strict Mediterranean diet, you definitely won't get dementia, but you will see benefits over time, across a large scale of people of a diet like this one. I'm gonna skip ahead really quickly. When it comes to fish, we have an acronym to help you remember what kind of fish is actually the most beneficial for the brain. First one is in that picture right there. It's actually my favorite. Salmon. Very healthy fish, lots of good fat. If you've ever cooked salmon, which I do often because I love it, it's got a lot of fat. You know, it gets really greasy when you cook it. That's good fat. That's an example of a fat that's you know, full of omega-3 fatty acids, which has an anti-inflammatory effect, which we tend to see really good things about when it comes to not just the heart, but also the brain. The next M on this list is mackerel, which I don't think I've ever had, but it's also a good fish. They're all good fish, but for our brains. Anchovy, which I think is a controversial and a bit of a polarizing fish. So I don't have any comments on that because I've never had anchovies. And another, I think, polarizing one is sardines. So if those two are, if you're a little bit of a maverick and you like those two fish, which can be a little bit controversial, then you're actually doing yourself some good eating them. And the last one is herring. So these are the fish that have a lot of those nutrients that end up being particularly beneficial for the brain and the heart.
Mina,
Yes.
can I just throw in with the fish?
Yeah.
It always makes me smile because I love all of these fish. And as far as anchovy, sardines, and herring go, my husband refers to them as those stinky little fish. And they are kind of smelly. To me, I like the smell of, I like them. I think they're delicious. So I love them. But that's, if you need a idea of what those fish are, I mean, you can get them canned, but you can also get them, at a good fish market, and you can cook them and do some good things with them. But yeah, they're the kind of the stinky little fish with the good oils in them.
Yeah. And so it's, do what you can with your diet. If you hate fish, like if it just grosses you out to eat fish, don't force yourself. It's not like that's the only thing you can and should be doing for your brain health. And we're going to talk about this is when it comes to selecting better habits for yourself and for your day, it's about what you can manage and what's sustainable over time. So going back to food, there were questions about alcohol, and the Mediterranean diet or the heart healthy diet dictates moderate amounts of alcohol. And I'll address a question that comes up that's actually a really good question is, when you say moderate amounts of alcohol, does that mean that that's better than no alcohol? If I'm not drinking alcohol, should I be drinking moderate amounts of alcohol? The answer to that question is that the research is showing more and more that the less alcohol you drink, the better that is for your brain, that there is a very noticeable impact of greater drinking of alcohol with greater cognitive decline. So if you're not drinking any alcohol, you don't have to start. If you are drinking what we would consider to be high levels of alcohol, there may be an opportunity to reduce that a little bit. I know that for some people, that glass of wine at the end of the day is what gets them through the day. So maybe instead of 2 glasses, that becomes 1 glass, right? So it's about something that's sustainable over time, not just making these overhauls of changes that you won't be able to keep up. There's a lot of talk about how red wine is good for you, antioxidants. You can actually get those antioxidants from your fruits and vegetables. So you do not have to be drinking red wine for those beneficial antioxidants. Low amounts of saturated fat, dairy, meat, and poultry. And then staying well hydrated. Water is kind of like the oil of a car. It just keeps your body running. It keeps your body from having to work too hard to keep this system going. So if you can sneak in a little bit of water right now, here's my reminder to you. And tea actually does count as water. So if you're drinking a lot of teas, especially herbal teas, that's okay, that counts. So cognitive activity, this is a really interesting one because we get a lot of calls, Jean and I and Jessica, as clinical care coaches with questions of, am I supposed to be doing Sudoku puzzles? Am I supposed to be doing crossword puzzles? Am I supposed to be using this particular app that I learned about on TV? Is that what I'm supposed to be doing? And the answer is, if you like it, right? So when it comes to cognitive stimulation, we're talking about things that have some form of challenge to them that you enjoy doing, that keep your brain alert and going. So this can be crossword puzzles, this can be Sudoku puzzles, this can be a phone app that does brain exercises. But if you don't like Sudoku puzzles, you're not going to do them, right? They can be beneficial if you're doing them all the time, but if you don't like Sudoku, then it's not going to be an activity that you keep picking up every day. So we want things that are consistent and sustainable. So there's some ideas for you on the screen. New experiences, reading is a good one, learning a new skill or language, learning a new cuisine, or picking up a language that you lost. Classes, lectures, discussion groups, games and puzzles. Listening to or playing music is a really powerful tool for engaging the brain and keeping the brain active. What cognitive activities do is they don't necessarily reverse a disease. What they can do is they can establish a cognitive reserve. What that means is strengthening the parts of the brain that are still healthy and still there to compensate for when something might be damaged, right? If you lose something, you want to strengthen what's really there to be able to compensate for what may be lost. And that's really the value of keeping the brain active and engaging in cognitive activities. This is another one, social engagement. This one has been popping up in our conversations, right? Researchers don't know, they do notice that more social engagement is associated, again, inversely with a risk of dementia. So there seems to be a good thing about social engagement going on. Now, the truth is, researchers don't know what this relationship is in terms of causality. Is it that social engagement is reducing the risk of dementia, or is it that cognitive decline and dementia are causing less social engagement? Do you see the trickiness of that there? We're not totally sure what's happening and why that association is there. But social engagement can also be a good barometer of a healthy lifestyle, right? If you're going on that walk and saying hi and running to people that you like, or, if social engagement is what keeps you learning and what keeps you interested in the world. This is a hard one to be talking about right now because it's the hardest one to incorporate into your life in a world where we have to stay separate from one another. But it's a good idea to try to manage what you can to stay socially engaged. So something like what you're doing today, joining in on an education class, interacting with people in the chat, sharing your own experiences. At Alzheimer San Diego, we also try to have virtual events to give people the opportunity to get together. Is it as lovely as sitting across from someone at the table and having a chat with them at a restaurant? It isn't. It just doesn't quite always replace what we used to be able to do. But we don't want to let perfect be the enemy of the good. We don't want to let circumstances have us become completely isolated if we can fathom or if we can think of ways to stay socially engaged. You can also see how social engagement weaves in all of these other factors that we're talking about. If you're eating well, you have a lot of energy. If you have a lot of energy, you're talking to people more. If you're talking to people more, you're probably, enjoying your day more. That's helping your mental health, which might be helping your sleep. So we're starting to see this picture come together, right, of the interconnectedness of the system. For me, one thing that I've been doing during these times is I have standing dates with my friends. And Wednesdays are when we get our phones out and we do a group video call. And I know that Wednesdays are my social days. And that's one way that I manage, right, is scheduling it into my day, knowing that that's going to come up. And scheduling your social life is actually a really good idea to maintain a social life. Sleep there. I actually did see a question about sleep, so I'm really glad that came up. Sleep needs do not change dramatically as we age. There is a lot of evidence that lack of deep sleep increases risk of dementia. So research is starting to presume and think that the function of sleep and what sleep does, that deep sleep, I'm talking REM sleep, when we're asleep for a long period of time, 7 to 9 hours, what that's doing is it's giving our brain an opportunity to go in and clean out toxins. And that's the function of deep sleep. So we're talking, like I said, 7 to 9 hours a night for adults, and that doesn't necessarily become less of a need as we age. We are kind of unique in our sleep needs. So someone might be feeling great on 6.5 hours. Me personally, my ideal night is 9 hours, which is a long time to spend sleeping. But I've noticed no matter how much I try to scale back, no matter how much coffee I drink the next day, no matter what I do, my body just craves that 8 to 9 hours. So we want to try as hard as we can to respect what our body's individual sleep needs are. So try to establish the routine around sleeping. This is, I think, the thing that people might inadvertently neglect most often. So we talk about sleep hygiene as a way to ritualize sleep and make it, more of a priority, or to engage more in a way that'll promote deep sleep. So the first one is have a routine around nighttime. This tells your body that it's sleep time. These signals that you send your body, dimming the lights, maybe lighting a candle or spraying the room with lavender spray so that it's soothing and calming. Just some kind of ritual that tells you it's time for the body to wind down for sleep. Making the room comfortable, these little tiny changes, right? Are you warm enough when you sleep? Are you getting too hot when you sleep? Do you need to have a fan on in the room? Is the room dark enough? These are the little things that we might be neglecting that might be taking away from our ability to get into that deep sleep and to remain in that deep sleep. So have an assessment of whether or not sleep time is comfortable enough for you to be able to get sleep. Naps, caffeine, and alcohol, we want to limit that because they do disrupt the sleep process. I'm a big fan of taking naps. I love them, but they can cut into our ability to get into that deep sleep later in the day. So if you are noticing sleep issues, that might be an angle to approach it from, is the napping. Caffeine and alcohol, like I said, tend to disrupt our sleep rituals. That being said, I drink caffeine. I'm not telling you to cut it out, but just, keep in mind, there might be an opportunity to scale it back. And again, here's that theme coming up of the interconnectedness of these different systems. Exercise really helps with sleep. When you exercise and you let off some of that pent up energy in whatever way that you are able to do that, it does help you sleep better at night, right? It's one habit trickling into others. When you sleep better at night, you're in a better mood the next day. When you're in a better mood the next day, you might not reach for the foods that are not nutrient dense. You might be more compelled to eat those healthier foods. So I really want to advocate for focusing on one habit at a time and noticing how it's able to affect the different systems in your life. So if you are concerned, talk to your healthcare provider. I know it's hard to get into a doctor's office these days, but give your doctor a call, shoot your doctor an email, whatever your preferred communication method is, and tell them what you're noticing to see if there are other things in your health that could be addressed. Hey, I haven't checked my cholesterol levels in a while. Am I where I'm supposed to be? Or I've been noticing some short-term memory loss. Can you do a test of my memory? It's okay to advocate for yourself, and it's okay to let the doctor know that you have a concern or that you just want to make sure you're on track. Regular assessments, regular checkups are a really good thing. Share your concerns with others if you feel comfortable. I know sometimes there is a little bit of a stigma that we deal with in our world when it comes to aging and when it comes to memory loss. But if you have people that you trust, letting them know that you're noticing something so that they can keep an eye out for you, so that they can give you some more information to work with. Because if there is a diagnosis to be made, getting that diagnosis earlier is always better. Memory screenings, just regular assessments of your memory, can be done at the doctor's office to be able to tell you what a baseline is, so that next year, if there's a really big change, you know to check in a little bit further on that. And also be aware that changes in memory and cognition can be caused by things other than dementia. Medications, right? Sometimes certain medications might cause a little bit of grogginess. Certain combinations of medications might not play well together and might cause changes in cognition and memory loss. So if you are noticing that, it's not a bad idea to take a list of the medications that you're on to the pharmacy or to the doctor and saying, do you notice anything that could be interacting negatively with each other? Depression is an often under-addressed and untreated cause of memory loss and cognitive changes. It is very frequently mistaken for dementia, but when the depression is adequately treated, many people notice that their cognition and their memory comes back to a much stronger place. Excuse me. Illness and infection can be another cause of memory loss and cognitive changes. Nutritional deficiencies can be a cause of memory changes. It's really important to address those. And that's another reason why having being in control of your health overall and quality of life overall is really important for your cognition, because if your diet is missing some key nutrients, this could be causing the memory loss. This could be causing the cognitive changes. Infections, especially urinary tract infections, they often go undetected, and they can cause this really sharp decline in memory. So that's also something to look out for. And then I think here are some resources for different places and different ways to get information. You'll see Alzheimer's San Diego is on there, but we put this slide in there because when it comes to getting information about a disease or getting information about interventions, medications you could be taking, nutritional supplements that you should be taking, there's a lot out there. You're going to see a lot of commercials. You're going to see maybe some emails in your inbox. It's always good to verify against a few different resources and say, what's the research on this? Was there a large scale study? Was there a large scale study that tracked over time? Is it a placebo effect that they're talking about here? And so we put this list of these organizations where before information is put out, they verify that and ask those kinds of questions. So always be careful that that if you do start any sort of intervention, that's verified by the science. And like Jean said earlier, to be a conscious and critical consumer, a critical thinker before starting a new regimen along those lines. You can always give us a call. If we know the answer to a question that you have, we'll let you know. And if we don't know the answer, even more importantly, we're going to say, I don't know, right? I'm not going to tell you what you want to hear. I'm not going to try to sound smart if we don't know the answer to something, because sometimes the kindest thing you can do is just be honest and say, I don't know. I believe, Jean, this might be where you hop in.
Well, we're going to go back if we could for a moment, and let's just ask Jessica to join us, and let's see if there's some questions here regarding all the information, good information that you just gave to us, Mina.
Yes. Well, a question I think was beneficial for all of our attendees is, do we know what type of memory test one would take at their primary care physician's office for a memory screening?
Mina, I'm going to defer to you because, in fact, you participated in the memory screenings that we were doing at our office.
Yeah, so there are a few types of memory tests that can be done. And the most common ones are going to be the mini-cog, the mini mental status exam, and the Montreal Cognitive Assessment are the three that I have worked with personally. And in a doctor's office, most likely one of those three will be the case, because they can be done really quickly, and they have been done so many times, and there's so much research on these tools that they're actually pretty good at telling you where your memory is, even though they're really quick. Sometimes they seem a little bit silly. They might have you drawing clocks and identifying animals, but they are actually really helpful tools. I would say if you do go into the doctor for a memory test, what's going to happen is you're going to come back with a score, and the doctor will say, this is where a typical score would have been. You're over this, and so I don't have additional concerns for you. Or you're under this, and so we're going to do further testing, right? That's when you would go into a neurologist's office and get a more comprehensive long test. If you're trying to just do assessments and have a baseline, I would say, have your doctor let you know which test you took that time. Keep that in your files. It'll probably be in your medical history. They'll probably make a note of it. And next year, when you're doing another assessment of your memory, make sure that that's pulled up and you know exactly which one. But to answer your question, there's a handful of them that are most commonly used at the doctor's office. I think the neurologists get a little bit more long-winded with that testing because they're trying to get some more information.
Thank you, Mina. Do we have time for another question? I had missed the chat question, so I apologize. But there was a question, and if we could go back to it, regarding risk factors related to PTSD. So is PTSD a risk factor for dementia, such as what veterans experience, but not physically brain trauma?
Good question, and I'm not sure I know the answer. You know, PTSD related to having some sort of concussive effect on the brain in the course of military service, we do know that that is a risk factor. You know, again, if people have been in combat in areas where there's explosions going on around them and such. But as to PTSD, not related to a physical injury, but to the trauma of being in combat, I'm not sure about that. I myself am not aware of anything. Mina, how about you?
I did just do a quick Google search to look at scholarly papers about that. There is a pretty strong association between PTSD and a higher risk of dementia. So that's definitely been documented. But PTSD is such a complex thing. PTSD can mean a lot of different things. It can mean kind of chronic depression alongside the PTSD. It can mean kind of hallucinatory episodes, things like that. So there's a lot that could be going on in the brain when you do have PTSD going on. So I definitely think PTSD is a risk factor. And I think that that's going to go back to our topic of mental health. Mental health, you know, the mental mindset somebody has, depression, things like that are going to have an effect on dementia. And so there is a risk, to answer your question. Yes, there is. And there also could be the reason for that risk, and the mechanism behind that risk could also have to do with what PTSD does to quality of life. As someone who is really struggling with PTSD, they could also be struggling with maintaining quality of life in other areas of their life. Are they isolated? Do they have the ability to have a healthy lifestyle? Is the PTSD getting in the way of that? So there's a few ways that PTSD could be playing a role in that increased dementia risk.
That sounds quite reasonable to me. I think that's a good answer, Mina. Anything else, Jess?
Well, it seems like we had a lot of questions regarding risk factors. Earlier, there was also one regarding migraine, if a migraine history could be a risk factor.
Again, that's not one that I have come across as there being any connection or correlation between the two. However, you know, I mean, this is a constantly changing and evolving field on a regular, like daily and weekly basis in terms of research coming in. Have you heard anything about migraines and any connection to dementia, Mina?
So I did another quick Google search on that one as well while we were talking, because I did notice that one. And there were studies that suggested an increased risk in dementia as a result of living with migraines. Again, it's hard to untangle what that relationship really is. So we talk a lot about how when we don't treat our chronic disorders or living with chronic disorders that affect quality of life, that's when we see an elevated dementia risk. So I don't know what that causality could be. I don't know if there's a mechanism in the brain that is also related, you know, a migraine mechanism in the brain that's also related to dementia. What I would say is if you do live with migraines, make sure that you're getting that treated, try to address how that's affecting the quality of your life. I think that right now with the research that we have is the most powerful conclusion that we can come to is make sure that we're addressing how migraines are affecting your overall quality of life.
Good. Okay, well, we're going to continue on here. And for again, for those questions that you have that we've not had an opportunity to answer, please contact us at Alzheimer San Diego. And here in this particular slide, you can see in the middle, we have our website, which is alzsd.org, and our general phone line, 858-492-4400. And yes, you can call and ask to speak to a dementia expert, to one of our clinical care coaches, and put the questions to us. We're on the phones 8:30 to 5, Monday through Friday. And you also have the opportunity on our website to, first of all, just peruse all the information that we have there about a bunch of different things, including some tip sheets and just good general information. You can also engage in some live chat with us on our website. So please do reach out as is needed. That's what we're here for. And let me just also say, just right from the get-go, that all of our programs and services are at no cost to you folks, to our families, to anybody calling us or wanting to use any of our services. So be aware of that. We do have virtual support groups going on. Of course, we used to do a lot of programs in person prior to the pandemic, and now everything is virtual. And so we've got, I think, about 27 virtual support groups going on. And I still use the phrase throughout the county. And, you know, I guess that's true to the extent that some of them are, you know, we describe them as being, say, in San Marcos or Vista or wherever they may be. Obviously, people might actually be living in other areas and joining virtually. That's totally fine. But absolutely, we have support groups for you folks who are care partners and caregivers. And we have specialty groups as well, too. For example, a men's caregiver support group. And so we do want to get you connected to those. We have our online education and training, which is what we're doing here today. And we have a lineup of classes, webinars that we're doing on a regular basis live. You will find that information also on our website. In addition to, we have a really terrific webinar library of previous webinars that we have done that are recorded. And Jessica, I'm going to ask you if you would to send that link out for our webinar library. You can have a peek at your convenience whenever it suits you time-wise to look at what we have there. We do have our volunteer tech team, and Tyann was here with us today, still is, and helping us out. What we do want to let you know is our tech team is available to you beyond, for example, today's webinar, the beforehand in assisting with technology. If any of you are having some problems with Zoom or FaceTime or whatever it might be, a tool that you're using to communicate with family and friends and health professionals, give us a shout, and we will put the request into our tech team to have somebody follow up with you and give you some guidance and hopefully help to resolve the tech issues. Prior to the pandemic, we did have social activities and outings going on. We have had some that have occurred since sheltering in place that have been virtual. And I'm going to speak to one that is coming up here right away in just a moment. We have reusable masks that volunteers have sewed up for our families. And if you need any of those, you know, they're fabric masks that you can throw in the wash. We can send those out to you. You just need to let us know that you need some. We do have our virtual All's Companions program. Again, it used to be in person. Now it is virtual. This is where we're matching up volunteers from the community with families. And they are coming together via Zoom or FaceTime or whatever it might be to have some time together, visit, talk, tell stories, maybe watch a movie together, listen to music together, whatever it might be. And so we're continuing to offer that particular program to our families. We do offer counseling sessions to our care partners who are also being adversely impacted by the pandemic and sheltering in place, just the dual, if not even more than dual, stresses of being a care partner during COVID-19 times. And we can get you connected with our colleague who is providing that counseling sessions. We have Vitals. This is a fairly new program that we have established. And this is, again, a volunteer-based program where we have volunteers that are staying in regular contact with people who are living alone in the community with some type of dementia. And so it's not only a social network, it is also a safety network by having the volunteers stay in touch with people who are on their own out there. So that's a little bit of everything that we do. We encourage you to, for sure, be contacting us. With regards to a social activity we have coming up that I think sounds like so much fun. And that's next week, January 20th, from 10 to 11 a.m. And, you know, goodness only knows, maybe we need some happy distraction that day, right? So this is going to be a reminiscence therapy program, and it's being presented by the Society for American Baseball Research, which I got to tell you, I didn't even know that entity existed. Now I do. And this particular gentleman, who is a baseball historian, and I don't know if I say his name right, but I'm going to give it a try. John, I don't know, Leonodicus, I don't know if I say it right, but so this is going to be who's presenting it, and it is a virtual presentation where all sorts of information, stories, trivia, I suspect music. There's always a little bit of music in the baseball realm too, right? And I have been told by colleagues who have been to a previous one that it was really fantastic and really lots of fun. So this is free and open to everyone and anyone. And in order to get the Zoom link, please just go onto our website here at alzsd.org/social-activities, and we'll get that information to you. I'm going to be joining it that day. I'm not even really a baseball fan, but I'm getting excited about it, and I'm thinking about the songs, you know, take me out to the ball game. I don't think you really want me singing to you here today, but anyways. So, and again, we're just reiterating the things that you can do to get in touch with us. There's all sorts of different ways and means and avenues. And so please do that, people. And I think Jess has sent out, yes, she did in chat, the link to the follow-up request form. So if you want follow-up from one of our team members, just complete that for us, and we will make sure that you're getting a call from one of our colleagues. Upcoming webinars is long distance caregiving. This is for care partners. So anybody who's dealing with the stresses and pressures of worrying about a mom or a dad or a sibling or somebody else who lives further away from you, and you're doing the best you can as a long distance care partner. That's a great class to come to. We've got driving and memory loss coming in towards the end of this month, and that's open for everyone, whether you're someone experiencing dementia or you are a care partner. And again, you'll see more information and the pre-registration instructions online. And lastly, as we close out the meeting today, you will receive a link to an online survey that we do ask you to complete, giving us feedback about today's program. As always, we review this information carefully. We do take it seriously and take it to heart in terms of how we can better our programs and the information we bring to you. Materials will be emailed to all registered attendees that have been here today. That will include the slide deck for sure. And again, the reminder that all of our dementia education programs recordings are available in our webinar library. So that's what we have for you today, folks. I hope this was helpful. It's a ever-changing field, maintaining brain health. We learn more on a day-to-day basis about the good things we can do and the things that we might want to change. And we encourage you to stay connected with us on that. And whenever you have questions, and we encourage you to have questions too. There's a whole lot of stuff out there that says this is the cure and this is the right thing to do and take this and take that and do this and do that. Be cautious, be careful, and be thinking about things and be questioning. And please feel free to contact us, and we will, join you in the questioning and at least give you the benefit of our professional and objective opinion. That's it for today. Thank you for joining us. Thank you, Mina, for, as always, being a terrific co-host, and Jessica for being our social work support here today in the webinar and answering and reaching out to those of you with questions and concerns. And as always, to Tyann as well, too, our volunteer tech team member. And that's it for today, people. Stay safe, stay healthy, be well.
Thanks for joining us.
Hopefully the next time we see you, we're moving along in a positive fashion further with vaccinations and a settling down for all of us. Take care, all.
Take care, everyone. Thanks for
Bye.
joining.